Return to function within scapular dyskinesia. Scapular dyskinesia is usually found in overhead athletes. Shasha et al. 2015. Scapular dyskinesia is known as an alteration in the dynamic scapular control and does not always cause pain when present. It has been shown that it can just occur and not be caused by a specific injury, but can lead to other injuries within the shoulder as it puts an increased amount of stress on the acromion-clavicular joint. This is usually misdiagnosed for shoulder impingement. Mora et al. 2016. Scapular dyskinesia is commonly known for affecting the raising and lower phase. The algorithm of the scapula is fixed until the first 30 degrees of shoulder elevation. This then leads into the movement coming from the scapula. Hidari et al. 2018. To assess scapular dyskinesia, a visual movement analysis will be done. This will be monitoring the movement of the scapula when going into the upward phase of movement and downward phase. Things to look for would be jumping of the scapula or anything that would affect the movement within the scapular rhythm. A strength test will be done using a continual passive movement machine. This can be done at the beginning phase and the end phase. Using an EMG machine for muscle activations will be very good for muscle activation and seeing results before and after. To help strengthen the serratus anterior muscle, a scapular wall press will be performed. Serratus anterior is reliable for the upward rotation of the scapulothoracic joint and the depression of the scapulothoracic joint. This should be performed 15 times and 3 sets twice a day to help with the dysfunction. This has been proven to be beneficial by the Mora study 2016. To progress from the scapular wall press, we will move onto the foam roller wall slide. This will only be done when performing the 3 sets of 15 repetitions become really easy and not feeling it working the muscle. The foam roller wall slide will be done from using 3 sets of 15 repetitions and again not progressed until finding it very easy. The next progression will be the TheraBand wall slide as seen in the video. This is to help strengthen the serratus anterior muscle. And to progress onto this one, if finding it easy, you will use the advanced TheraBand wall slide. This is also to help strengthen serratus anterior. This exercise should be performed 3 sets of 15 repetitions. To help with lower trapezius activation, a YWT will be used to isolate the lower trapezius muscle. This will be performed 3 sets of 15 repetitions. The YWT should only be progressed if feeling that it's becoming too easy. Moving on to a YWT on an unstable surface. This will also help to activate the lower trapezius muscle, but also use the core stability. This will help with mobility and stability within the shoulder joint. This exercise should be performed 3 sets of 15 repetitions, as showed from the Mora 2016 study. This exercise should not be progressed until feeling of it being easy. Moving on to a seated TheraBand row. This will help to isolate the lower trapezius from keeping the elbows tucked in and pulling straight back behind. The lower traps are responsible for depression of the scapula and upward rotation of the scapular joint. This exercise should be performed 3 sets of 15 repetitions. Moving on to shoulder flexion. This will help with the mobility in the shoulder joint and also activating the lower trapezius muscle. This exercise should be performed 3 sets of 15 repetitions. To progress from shoulder flexion, we will use a light weighted ball to help increase the activation of the lower trapezius muscle. This exercise should be performed 15 repetitions and 3 sets twice a day. This is a TheraBand pull and will be used to help strengthen the posterior fibres of the deltoid, which extend the shoulder at the glenohumeral joint, laterally rotate the shoulder and horizontally abduct. This should be performed 3 sets of 15 repetitions. To progress from the TheraBand pull, you will move on to a lateral extension pull. This will help to isolate the posterior fibres of the deltoid. This exercise should be performed 3 sets of 15 repetitions, and then to progress to a wide grip inverted row, also used to help isolate the posterior deltoid fibres. This exercise should be performed 3 sets of 15 repetitions, twice a day. To progress from this exercise, you will move on to a dumbbell bench row, which should be performed 15 repetitions, 3 sets, twice a day. This will help to isolate the posterior deltoids and also activate the pectorals. This exercise is internal and external rotation within 30 degrees of scaption. This will help to activate the rotator cuff muscles and also provide stability for the glenohumeral joint. This exercise should be performed 3 sets of 15 repetitions. To progress from the internal-external rotations, you will add a light weight. This will just help to increase the activation of the rotator cuff muscles and should be performed 15 repetitions, 3 sets, twice a day. This exercise is a rotator cuff activation, which will help to stabilise the humeral head inside the glenohumeral joint. To perform this exercise, you will do it 3 times of 15 repetitions, twice a day. You will add resistance when moving the bar from side to side to help activate the rotator cuff muscles. When moving on to the next rotator cuff activation exercise, you will bring the bar behind your back to help activate the posterior deltoids and rotator cuff muscles. This will also provide stability for the humeral joint. To add resistance as you go side to side to make the rotator cuff muscles activate more. This exercise should be performed 3 sets of 15 repetitions twice a day. This will also help to activate the rotator cuff muscles from an isometric internal and external rotation. From performing this internal rotation, you will press into the wall and hold between 20 and 30 seconds. You will do this for internal and external rotation to help activate the rotator cuff muscles. From keeping your arm in a 90 degree position, add pressure as you push into the wall. Internally and externally rotate. Moving into some stability exercises for the shoulder is some shoulder touches, and this is beneficial for the core, glutes, arms, wrists and shoulders, mainly to help stabilise the humeral head in the glenohumeral joint. All of these exercises can be performed alongside the strengthening of the muscles. This should be done 3 sets of 15 twice a day. Then moving on to the Y test, and this is to help improve shoulder stability. This should be done twice a day, 3 sets of 15 repetitions. This will help strengthen the rotator cuff muscles and the shoulder mobility. The Y test should be performed 3 sets of 15 repetitions twice a day. This is very good for assessing for scapular dyskinesia, as it will show how stable the shoulders are. The waiter's walk is very beneficial for stabilisation within the shoulder and helping to strengthen the shoulder stability. It's also very beneficial for scapular activation. Quadruped thoracic rotation is very beneficial for strengthening the upper back or the thoracic spine. This will be done between 3 sets of 15 repetitions and 20 seconds rest in between each set if needed. This is to help with shoulder mobility and can be done on all fours with a small ball, just rotating in circles. This should be done between 20 and 30 seconds. You can use a larger ball and outstretch the arm in front to increase shoulder mobility. This should be done between 20 and 30 seconds, as many as you can do during that time. Repeat 3 times. An inchworm into a down-faced dog is really good for lengthening all the muscles and helping with shoulder stability, but without putting too much pressure on the glenohumeral joint. The Atley scratcher is good for a shoulder assessment on how much mobility they have within the shoulder joint. It's also good as a general mobility exercise to help increase the shoulder mobility. This exercise should be performed 15 repetitions and 3 sets twice a day. This exercise is to increase shoulder mobility, and by depressing of the shoulders and engaging all the shoulder muscles, it's great for the mobility and increasing at that joint range. This exercise should be performed of 15 repetitions and 3 sets with 20 to 30 seconds rest in between to relax and ease all the muscles. This rehabilitation plan makes it possible for people with scapular dyskinesia to return to full function within 4 weeks, although every individual will have slightly different responses to the rehabilitation plan. This plan looks at rehabilitating and strengthening all the correct muscles which have previously caused a dysfunction within the scapular rhythm.